Welcome back, my friends, to the show that never ends.
Welcome to the show that never ends. Sexual Healing Podcast. Conversations will address concerns and celebrations within the misunderstood and misinformed world of sexual being. Your hosts, Dr. Bill, Mac, and Pipes, bring insight from different sexual health perspectives, covering 70 years of experience.
And we are back. Hi, guys. Welcome to Sexual Healing Podcast. We are here with my friends, Mac and Pipes. We're reminded by why we're here in the first place. One is to all of us take a moment to look at Pipes and look at her hands, which everyone tells me, at least on social media, they're full of expression. And so luckily we have Jose and Shelby. Normally Shelby's here in our production team. And Holly. Shelby and Holly are actually in Dubai right now, which is crazy. Because when I dropped her off at the airport, it said gate to Mumbai, but she calls me and she's in Dubai. So I'm not sure where the hell she is right now. But she's working on opening another sexual healing podcast satellite office in Mumbai or Dubai. So
I don't know if I'm buying that one.
Oh, all right. Well, that's what she told me. That's what she told me.
All the burpas. I mean, that's totally a turn on. Yeah, all the burpas. Okay.
Okay. So make sure that you have your own separate email to get all the criticism that we're going to get from that comment. I didn't even show up yet. But we thank all of you for tuning in. We thank all of you for listening to our previous podcasts on Sexual Healing Podcasts. And every time that Jose and Shelby / Holly and Cody, our supervisor and director for security, as well as the minor players, Mac and Pipes, get together, we are reminded by how important our mission is. And our mission is to entertain and to educate and talk about sexual health. And it's very interesting when normally to put on a half hour, 45 minute podcast, I can tell you that all three of us really hunkered down and put a good, 30, 40 seconds in discussion and trying to prep 45. For this, 45 seconds. And you pointed something out earlier, Mac, that when you were talking to all of your friend who listens and subscribe to Sexual Healing Podcast, they want to know what it was about. And they assumed it was what? Was it what we're trying to do, or what did they dummy it down to?
I mean, it's sexual. They think sexual health is like what's wrong with you. Like you have HIV. You guys talk about HIV. You talk about STDs and gonorrhea and things. It's because to them, they never really had a conversation what sexual health really is, and it may just be street cred or street talk that says and I hate to use the word ignorance, but just unaware. They're just unaware of the importance of sexual health in our everyday lives.
Well,
that's why I said, tune in, you'll understand what we're doing.
Yeah. So Pipes, with your girls, when you had sex talks with them, was it all about the bad things that could happen, or were there some positive aspects of sexual health that you discussed?
Always, like both sides of, there's
those the hands. They're very expression-like.
They are a nightmare. I got to cut those things off. No, I always talked about both sides of everything. I think that knowledge is power, obviously. And so talking, and here's my thing. I always was a pretty straight shooter. Penis, vagina, blah, 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 blah. All of the things that people don't necessarily want to talk about or address like straight on, which I think is so odd. But no, I talk to my kids about all aspects of it, for sure. And yeah, I talk about the negatives. But it's funny that you say that, Mac. Like, when I talk about doing this podcast, first of all, people are like, you have a podcast? Like, what the hell? What do you know? Which is true. And but most importantly, people are so like sexual healing. They the people that know my background, that know that I worked in more so the erectile dysfunction field, um, are really so kind of, oh wow, when I start talking about the conversations that we're having, that we are talking about, sexual health between males and females. We're talking about, pornography and the effects of how what happens with your sexuality in that aspect. I mean, all of the things that we're discussing, they're they're really fascinated that we have, like you said, Matt, this isn't about STDs and HIV or just strictly erectile dysfunction. We're going to hit so many topics, and we're going to talk about male, female, everything. I mean, that's the beauty of it.
Let me ask Jose, once he gets his fingers off the soundboard here. When we talk about the sexual healing, what comes to mind? Now, you came in to us as a novice in the medical field, and certainly a novice in sexual health, according to what your wife has told us. But you also, I mean, you're here because of your expertise in electronics and production in audio video. But what were you thinking that when you signed up for this, what our table of contents would be, what we would be discussing?
Common practices, involving sex, STDs, taboo, urban legends, whatever you want to call it. I don't know.
So you went beyond what Mac's circle of friends went. You kind of looked at the whole spectrum of what we had to offer. And that's good. I mean, that's certainly insightful for someone who is just a what are you like? You're half the age of Pipes, right? So at 69 with Pipes, she's relatively developed in her assessment of sex. You are pretty mature at being half her age on what sexual health is all about. So when we talk about sexual health, for my co-hosts Mac and Pipes, what are we talking about? Should we throw out stuff that leads to poor sexual health in our own medical status? I mean, what are the things that we talk about? We've kind of mentioned it before, but let's deep dive into it and see what you guys come up with. Mac, what can you tell us about things that we do that may lead to poor health sexually? All right, and so one is a speech problem that some of us have with Mac where we can't hear what he's saying. All right, and it shows the frustration that he has. So a lot of times when we talk about sexual health, there's some medical problems that Mac is able to talk about now. Go. Okay, so I got the thumbs up for nothing, Jose. All right, so we're still working on that.
I could hear David.
Okay, so tell me, and our audience can't, so we have to figure that out. So, Pipes, tell us about what your thoughts are on what medical problems lead to sexual health concerns.
Oh my gosh, that's just such a gamut of things. I mean, you can talk about why can I never say comorbidities?
You just said it.
I just got it? Okay, so
you're healed.
I know, I just tried to say it again and couldn't get it out. There's so many aspects of this, and it isn't just erectile dysfunction. It isn't just STDs. It is not just, all of these things. Everybody thinks like sexual health, sexual healing, they go down, it's such a path that people go down. And the whole point of this is to discuss, like, one, how to get through sexual health issues, and also how to interpretate, like, all of these things. That being, if it's communication, if it is pain during intercourse, if it is not the inability to have intercourse. I mean, I don't know.
Well, let's for females, when we talk about painful intercourse, what comes to mind? You've mentioned your own challenges with hormonal fluctuations. What actually is occurring? And I'll kind of compare it with what I see in my office. What do you hear from your peers about painful intercourse?
I think the thing about painful intercourse for women is the older we get, then the less lubrication aspect of things. And if, depending on your relations prior to going through menopause, for the sake of argument, because that's where I'm at, is not having to use any additional lubrication, things like that. So it's a weird concept to then have to bring something else into the bedroom that you haven't had to do in the past. But it's a necessity to move forward with your, sexual relationships, because that's the norm. That's the body. That's how it works. And people don't understand. Our bodies are changing, going through puberty, going through, the younger years, and now, going into the senior years, as much as I hate to say that. But, the menopause aspect, intercourse is very, very different for women, because your body doesn't react in the same way that it did when you were younger. Well, and I'm talking, you could go from 45 to 50 and there's a big change.
Let me ask Mac this, and I appreciate your candor, but Mac, is it a turnoff for the male partner for your female partner or your partner to bring in lubricants into the bedroom and introduce other things rather than natural lubricants? Is that a negative?
As a male, I can't see it being negative. I haven't experienced that, so I don't know personally firsthand. But I do know from the experience that working with you and Pipes is, we dealt and worked with, dealt's better, we worked with a goal of helping people get to a good, positive sexual health. And if it's outside apparatuses or lubricants or something, it gets you there. That's what's important. Back in school, we took sexual health classes, but what they teach us, basically reproductive systems, and we always seem to gravitate towards the negative. And I think our sexual health classes back in school, when I was in school, wasn't all that positive, because we got in the corridors afterwards and joked about it, and it was all about reproductive and use preventive sex and all that stuff. But I think if we could educate our young people the importance of sexual health like it is physical health. We tell our young people, for physical health, you need to exercise, you need to have a good diet. Well, you know what? Guess what? Those are connected to sexual health as well. So I know I'm getting away from your question, Dr. Bill, but if we continue to focus on what good sexual health is, and we can define that, then no matter what you bring into your bedroom or to your place of worship, being in sexual worship, then you'll have a good experience. You'll be positive. Both partners will be happy and satisfied and say, oh, we had a great time. And yeah, so there's nothing wrong with exploring whether you need to or you want to.
And I think that's a great comment. And you remind me of my own experience in sexual health classes when, I guess, in elementary school. And it actually occurred at
kindergarten for you.
Yeah,
so
kindergarten. It actually occurred at the same time that driver education and not drunk driving. So I always get confused when I hear about the movie title Red Asphalt. I don't know if it was speeding and drinking and driving or if it was a sex class. So those times were very, very confusing for me. But when we talk about, Pipes has, brought up the point about vaginal lubrication, which is an indicator not only for menopause as we age, but it also is an indicator for how turned on women are mentally. And it also has to do with certain medical issues like diabetes or cancer, treatments for pelvic cancers with chemotherapy or radiation. All that can hit any of us or any female for those kinds of gynecologic issues, and it doesn't have to be age related. And so introducing or expanding your sexual menu, bringing in lubricants, one way of doing that is certainly natural, certainly common, and very important, because lubrication adds to sensitivity, and sensitivity leads to orgasm, and orgasm leads to more orgasm. So it's a good thing. So
orgasms lead to good mental health,
without question,
right.
question.
And I think, like, and I've talked to, my colleagues, my peers, friends, acquaintances, whatever, and lubrication is a norm with some people, with others. And so it's just, every individual body is different. It's not a bad thing if you have to bring lubrication in. It doesn't mean you're hitting menopause. It doesn't mean that you're not sexually attracted to somebody. There's all of these different thought processes depending on your body. Me personally, I mean, that just wasn't the norm. I mean, I was capable, without lubrication, to go through the process. But
don't call it a process. The fun experience, the love.
but I think, like, then for me as a woman who my body never had a problem, like, what's the word, Dr. Bell? Like, give me the medical term.
Sleeping with a lot of guys.
Yeah. It wasn't a thing. So then to go through whatever my body is experiencing later in life, and to have to do something like that's a weird concept. Like, what is happening? What is the matter with me? Now you go through is this normal? This hasn't been the norm for me in the past, and now suddenly I have to have something else brought into the game here. I have to bring lubrication in. Is it my partner? Is it me? What's happening here?
Right.
So Bill.
Right.
Go ahead.
No, I was going to say.
Yeah.
No, go ahead. Go ahead, Pipes. Pipes, go ahead.
Well, I'm just saying, like, I think that here's the sexual health aspect of it. People don't understand it's the normal, like, progression of our bodies and life and age and everything else, but nobody talks about that aspect.
Well, they talk about it on a one-on-one to physicians who want to listen, but
sometimes,
yes,
sometimes. And
the concept of this being not natural or not normal or not what I used to have to go through is not unique to women. We see a lot of men who are pissed off that they have to take extra testosterone, or they take Viagra type medications, Levitra, Cialis, whatever, because we never used to have it. Or I used to be able to have 3 or 4 orgasms in a night, or my erections would last hours. And some of it's bravado, but some of it is related to what things used to be like years ago. And it's no different for the athlete who used to run marathons, and they can't do it anymore. Our body
funny, Bill,
changes.
You bring up the drugs, the Cialis and the Levitra and Viagra, and men all of a sudden they have to do something different. But I would like those people who bitch about taking a drug to help them go back 30, 40 years to men who had no options. They were just dead in the water. They would have loved to have brought something in just so they could participate. And it's so funny how you say we advance. and we learn and we grow, and more things are available to us. But there's such a generation out there just missed out on that. They went down without a fight because they didn't know what to do.
That's a mental health issue that is very interesting, and it also speaks to what Pipes has talked about, is that oftentimes when you have someone who, for whatever reason, their metric for success is their erections are bad relative to what it was 10, 15, 20 years ago, or 50 or 60 pounds ago, or 40-pack years of smoking ago, or diabetes or other medical issues, the partner often says, gee, it must be my fault. I'm no longer attractive. Or my husband, my partner is having an affair with somebody else because he's not performing in the bedroom. And actually, there's a word salad here, because now in 2022, we have a lot of different pronouns, but it has to do with partners, and whether it's same sex or opposite sex. No one is immune to jealousy and fear and body image issues and self-doubt, and we all experience it. Whether it's a partner with another partner, I'm no longer attractive, body image issues. These are all the mental aspect of sexual health, and how it can turn against us and eat at us and destroy our egos. But what can we, and so you all bring up some great points. It's not unique to men or women. It's a couples issue, and for those many people who rely on unpartnered sex, self-stimulation or masturbation, when they just can't get the erection they used to, or they can't experience the orgasm they used to with self-stimulation. It's very frightening. It's very scary. It's very depressing.
So, Dr. Bill, I have a question for you. When a male or female comes to you and says, "This is happening to my body. I'm not responding. It's not whatever. It's not that it used to be. Whatever the norm was." I'll put it that way. Do you, in your questions, your history of physical steps in your practice, is there a key word or a key description that you go, I think I know where this is going? And do you refer out, say, for somebody who maybe be pre-diabetic and they don't know it, you'll send them to an endocrinologist, or do you send them to a cardiologist? Is that part of your workup? Is that what happens? Or how do people as a whole, find out what they're hurting from? What's affecting their body that's not allowing them to be who they thought they were?
Well, it's usually multifactorial. It's not just heart disease or diabetes. It often is depression, or it's poor controlled other medical issues, or there are bad relationships. There are toxic relationships where people feel pressed to perform. So in my background, as you guys know by now, is heavily weighted towards psych and aberrant behavior. So I kind of enjoy that aspect, and I enjoy the interaction. And so we talk about couples within reason, within the confines of my urologic practice. So yeah, I have a very strong outbound referral pattern to cardiologists. I take care of most of the endocrinology things, but severe diabetes, no. When we talk about hemoglobin A1Cs, every diabetic should absolutely know the definition of that. And that, as most of you know, but many don't, hemoglobin A1C gives you an average of what your sugars have been. So we want to be 5.5 and 6. Now, don't go crazy with these numbers, because some people who are poorly controlled would really enjoy a 7.5. That's a win for many people. But the norm is just under 6. But I've seen people that come to me with the primary concern that their erections in the last 6 months have dropped, and we examine them, they're spilling sugar in their blood and their urine, and they have hemoglobin A1Cs of 14, and that gets me nervous. And so for those guys, oftentimes getting their sugars down to a level below that 14, towards 7 and 8, restores their sexual function. So yeah, we use referral patterns all the time. You got to be aware of it. So
if we can ask a question to our audience here, and we were to say, and to kind of open their eyes and say, what is a common watch out? Is it how sexual health is connected to mental health? is how sexual health connected to physical health. What would be a watch out we could ask our audience right now to say, hey, if this is, I mean, I know it's very broad, it's probably too broad, but there's got to be a couple things that we would want to say to people to watch out, look for. What are some signs out there that they might want to be aware of?
Well, you know what? We should actually put out our algorithm out there, and that's that algorithm that the three of us worked very hard for our continuing medical education classes. But there's an algorithm to look at, and yeah, there's some basic hormones and blood tests that we look for. But look at your lifestyle. Do you drink? Do you smoke?
Okay.
Do you exercise? Is your weight higher than it wants to be? Do you have a communication issue with your partner? All those things are red flags for having some issues. Yeah, people get
yes, no, yes, no.
Okay. And so
there's but you're exactly right. Communication. I'll be honest. Like, let's look at generations. My dad is diabetic, type 2 diabetes. My grandmother was diabetic. Obviously very prevalent in my family. Not conversations that are happening. Okay, now with my background in this whole thing, obviously my dad is not going to talk to me about his erections. And I do bring up erections regularly, or, sexual health and all of this stuff.
Or lack of erections.
Right. And it makes my dad very, very, very uncomfortable.
Is this why I've never been invited to a family Thanksgiving dinner?
No. There are so many reasons
her daughter
I haven't been
about lack
invited.
of erections? Yeah.
No, but like my dad, this is not a conversation. My dad's in his late 70s. Oh shit.
You missed his birthday?
Mid-70s.
Oh, I think you missed his birthday?
No, but he'll totally, he's like 75, so he'll be like late 70s.
He doesn't listen to the podcast. We've asked him to subscribe. He told me to screw off.
he doesn't even own a cell phone. He is like so off the not media radar, anything. So I can say anything I want about Dick, and that is his name. He's the reason. He's the reason I'm here. Dick.
Are you rebellious?
Thank you.
Rebellious? Yeah.
Yeah.
Well, Bill, so if Trisha's dad came to you and he says, I'm having these issues, and Trish wasn't in the room and didn't know anything about it, and he's 75 years old, you'd say start exercising. And what would that exercise be?
I'd say get rid of your daughter. She's toxic. All right.
She put too much pressure
been trying
on you.
for years.
She's put too much pressure on you.
There's too much pressure. So
it's very uncomfortable for my dad to even hear that I talk about stuff like that.
Well, I put it in perspective. You have to put it in perspective. Are you embarrassed by diabetes or heart disease or having a thyroid problem? The answer should be no. So in that same way, you shouldn't be embarrassed by sexual dysfunction, because it doesn't mean it's in your head. Now, it's all in your head. 200 years ago, yeah, that's what people thought.
Let me stop you. That was a very powerful comment.
I'm a powerful guy.
Do you want me to repeat back to you?
Please.
Do you remember what you just said?
I could reread it because I wrote it last night, but go ahead. Tell me what I said.
No. Are you embarrassed about diabetes? Are you embarrassed about cardiovascular disease? Are you embarrassed about... Here's the thing. Everything that we're bringing to the table is uncomfortable. We're talking about erectile dysfunction. We're talking about incontinence. We're talking about inabilities for people to connect physically. This is not a comfortable topic. You're right. People will talk about diabetes. People will talk about the fact that they have AFib. All of these things. What we're doing is we're bringing very uncomfortable conversations to the table.
So why are we comfortable doing that? And I think it's because of our backgrounds, Pipes. If you and I hadn't gotten in the medical industry, and Dr. Bill would have regarded that was his destiny, we would be uncomfortable talking about sexual health. But because we've seen how people suffer from it, and we have the inclination to want to help and assist, that's why we're here today, right? I mean, that's why we stayed in the business for 25, 30 years, because it was rewarding not the same level as Dr. Bill, but it was rewarding for us who have, just regular non-science degrees.
Well,
Agreed.
this is a good point. Hold on, Pipes, because I get hammered on this. No, you hold on. Okay, as a Jewish urologist, I'm very close to being white and having white privilege. So hold on, I'm that close. All right, I just want to underscore that Mac has totally disregarded your bullshit BA in psychology or whatever it is. So I want everyone to know you have that degree.
No, I didn't say it was science.
Voodoo psychology.
Thank you. Thank you for having my back on that.
You're welcome.
But you know what? You are right on. Would these be comfortable conversations if I didn't go down this path?
Career path, yeah.
And it wouldn't have. These wouldn't be. I feel like I'm a pretty sexual, like capable of having conversations about sexuality and all of this stuff, but difficult conversations. It for me, and I think for you, and obviously for Bill, these are the norm now. We just start talking to people about things that are not common conversations, just going down a path. And I love that. I love that we're in this position and that we do have this comfort level. But yeah, no, you're 100% correct. Even with my psych degree,
well, you talk about you want to have a conversation about sexuality in the past. So your conversations in the past with sexuality, are those with girlfriends or guy friends before you got into this career? Okay, but it was only superficial, though, right? It's not in the depth of what we know today.
Exactly,
and that's why I think that.
Exactly.
Yeah. Okay.
Yeah,
right.
you're spot on with that, and the fact that now when I do start these conversations, or people will talk to me about some of their things because they know I'm looking at it not in a
judgmental way,
candid off the cuff deal. They truly know, like, this is my passion, and if somebody was to come to me with something, I would
fly them down to Fresno.
Had a problem, I'd try to figure out a way to fix it or to make it right.
So
and I would go to the experts. I would go to Dr. Bell. I would have these conversations and say, hey, this is a need. And the comfort level that people have with me at this point, because of my background now, is huge. I love the fact that that they're willing to have that conversation, and knowing I may not have the answers, but I know people who do have the answers, and I will get you something.
We've thrown out some medical issues. What about psychological issues? Anxiety, depression, self-doubt, all the things that occur, self-esteem issues, all those things that all of us, no matter who we are and what we do, have touched our lives somehow. How does that impact sexual health?
It's funny. We grew up, in a time, not a time. Everybody goes through this, no matter what time you're in, what generation. In schoolyards, just getting beat up by friends. Kids are mean. And sometimes when they start talking about a lot of things they talk about, you can take them into your adulthood, whether it's you have little hands or whatever. You have little hands or something. So I think that's what hurts most is sometimes we take stock from people who say things that don't know anything. They don't even know what they're talking about. But back to answer your question. What was your question?
Your hands are fine, Mac. Your hands are fine. I see a lot of hands. All right, every day.
No, the importance of sexual health, it's everything. It's mental, it's physical. Mental is if you feel good and confident about yourself. And how do you feel good and confident about yourself is accomplishing things. And I'm not talking about sexual quests. I'm talking about whether it's work, whether it's hobbies, and you start feeling good about yourself. Say we have a hobby. And we're involved in that hobby, and it turns out great. We have confidence in a hobby, but then we go to another part of our lives where we kind of stagnated, and we're like, oh, gee. And I think that's where we sometimes get with sexual health, because it's not always in the forefront of what it takes to have good, strong sexual health. So therefore, it beats up our mental health. So our mental health really drives who we are from a physical point and from a sexual point, because to be physically fit or physically healthy, we've got to go out and work out and be involved. And that takes mental strength to get us off the couch and go. Same thing for sexual health. So they're all interconnected. None of them stand alone. They're not in their own silo. But it's very important. We've got to address all aspects of our health.
I get a lot of patients who have been diagnosed with depression and anxiety and been offered an antidepressant or an anxiolytic, something that breaks up anxiety. And they look at the side effects, sexual health, and they choose not to do it. They choose not to do it because they don't want to give up their last bastion of control, which is sexual function. And so how do you deal with that?
Because they're really good at it or because they're not so good at it?
Good at sexual health? How do you define that? That's, unique to the couple. Yeah. Well, they're not going to give it up. Whether it's good or bad, it's there.
Okay.
Good sex, bad sex is still sex. Right?
Like pizza?
Pizza.
But I look at the fact, like, if you're unhappy, if you have depression, and that, for me, like, that would affect my sexual health more than the side effects from the drug, in my opinion.
Yeah.
And again, that's a personal statement. I, use some medications for sleeping, for depression, things like anti-anxiety, all of these things.
Like heroin and cocaine, is that good for anxiety and depression?
Fentanyl.
They are.
Okay.
They are good. In small doses, only on Tuesday.
Okay.
Yes, tomorrow. Tomorrow's your day.
I know. Trust me. Let's do this tomorrow. And
For the one of you paying attention about my comments, I'm joking. All right, JK, go ahead.
We're all joking about that. But I, like, for me, if I don't feel good, like, mentally and physically, who the frick cares about the side effects of a drug? And this is me. I'm being very, very candid here. Like, I take an antidepressant for sleeping, more for sleeping. I did Ambien for years. Traveling, I was in different time zones. I just needed, my brain's constantly going. My brain's going as fast as these hands are. So there's always an issue for me in that capacity. So I ended, I'm on an antidepressant. I think that's what I'm doing. I've done anti-anxiety because traveling was hard and being on the road and all of these things. Medications haven't necessarily affected me sexually.
That you know of.
That I know of. Right. That I know of. I need to have some sex and then I'll tell you. I gotta go back and what that is. But for me, like, my ability to sleep at night, to have a good night's sleep, my ability to not have the anxiety that I have within, all of that was way more. I'll bring some lubrication to the table. If that's what is going, like, I'll take the good and the bad, but it's figuring it out. And nobody wants to talk about it, and nobody wants to go down the path. Like, okay, what am I willing to give up for my mental health, for my sexual health? But what can I bring to the table to keep my sexual health healthy?
Well, it's not one or the other. And what you bring out is that you can treat one disease. First of all, how do you simply, for all of us out there listening, how do you define depression? It's without anything. It's without a desire to do anything, without a desire to get up off the couch and walk to turn the TV off or walk to the refrigerator. And for those guys who are that depressed, it's without the energy, interest, or desire to have sex. So we can take antidepressants to build up that energy, right? And we can fight.
When you're at the level that you're not getting off the couch to go to the refrigerator, the last thing you want to do is have sex.
Exactly. your doctors, your psychiatrists can fix that.
Right.
If you give them a bag of Cheetos, they'll have sex all they want.
Well, by the way, for women who are uncomfortable with certain antidepressants and their hit towards orgasm, the use of Viagra is the only FDA approved. I looked at this a few years ago, and I think that's still the case. The only FDA approved use of Viagra in women is for sexual dysfunction induced by antidepressants. So you can take your antidepressants, get Viagra, and take care of everything. So
is this all PD5 inhibitors or just Viagra?
Yeah, I use Viagra because it's the most common one, and I think Viagra is the only one tested for this. Again, because there's no money in it. It's a small population, and we've talked, and everyone I think at this time is aware of our position on Big Pharma, or my position, but there's no money in it, so why do that? And that's not me speaking, it's Big Pharma. But yeah, for guys who do what I do, it's common to use a combination of hormones and antidepressants and Viagra type medicines to fix that. So depression is one thing, so let's normalize this. If you're depressed, don't be afraid of hitting it more and hurting your sexual function. For both men and women, there are fixes for that. In fact, premature ejaculation, which is a common complaint, probably the most common complaint across the world of sexual dysfunction in men.
Every guy I've ever been with has premature ejaculation.
Okay. Well, okay. First of all, then that's the end of my bar stories. All right, with you.
We were kind of speechless.
Okay. So later on,
premature is 30 seconds, a minute, 2 minutes.
Jose. So we were going to close this out with a 2-hour trailer on every man that Pipes has been with. Let's not do that. We could be sued because all those thousands of sailors somewhere are going to sue us for defamation of character. But you've had to share sailors. But
you guys are familiar with the show Big Bang Theory, right?
Yes.
Yeah.
The cast of characters, and how Sheldon has always given Penny, or the neighbor, a hard time about the number of women or number of men she's been with. Do you guys recall that?
Yeah.
Well, that's kind of what we're doing right now. We're giving Trish a hard time.
So we're the Big Bang Theory. Okay, I'm retiring. So there is value in these medications, so don't be afraid of it. Let's take a different turn and talk about when it's great and good and healthy to be becoming sexual. When is it actually bad for us? Any thoughts on this? Because I see this every day. I see this every day in my practice. Is that question clear enough for you to jump in on?
No.
All right.
Well, I guess when you start feeling no feelings for others, when you're just out for a quest, if like, hey, I'm just going, what's the term out there now? Our young daughters use dating when you get ghosted, or and some people just go out there and they try to hook up, and somebody will want a relationship, and I just want the physical aspect, and they're gone out the door the next day and they don't come back.
Well, that's like Tinder. That's Tinder or whatever those sites are. They're complete hookup sites.
Yeah, hookup. Okay.
Relationship, and I think that is not a productive sexual health concept.
No, but also these Go ahead.
Yes, people want to, it's the physical aspect without any of the emotional attachment. And yes, everybody's talking like this is great, blah, 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 blah. But in my opinion, and again, we might be going generational, blah, blah, blah. Maybe that's what the younger generation wants. But that's very void of physical interaction. It's a sexual thing, but the physical interaction is so not. There's no. God, what's the word I'm looking for?
There's no connection.
There's no intimacy. There's sex. There's no intimacy.
Well, let me ask you guys this. We're of the age where we all have friends or family members who have lost relationships, have had previous strong relationships, and through death, divorce, sickness, change in lives, change in lifestyle, they've lost partners. And so I see a lot of men and women hitting the gym. Not that I go to the gym, but I just go there for the fruit bars. I don't actually work out. But you can see all these people who are out trying to get in shape, look better, buying clothes, renting cars, women wearing jewelry, being seductive, and in order to meet new partners and being sexual because they think they have been indoctrinated and that's the way to jump back and be social. But when they finally get that the communication, the relationship is based on how hot they look or how well they dressed or how well they're playing it, they're offended. Why can't someone like me for my mind or who I am? All they want to do is get laid. But aren't we perpetuating that? Isn't that a negative thing when it comes to sexuality?
You talk about big pharma and about the money, right? Well, that's the same thing. If you look at pop culture, it's all about being thin or muscular. It's being fit, attractive, and that's what people want. So we are inundated with what it takes, what Hollywood thinks is sexy. I mean, we all have different definitions of sexy and attractiveness is and stuff. And I'm not saying they're wrong. I'm not saying being physically fit is unattractive. That's not what I'm saying. I'm just saying people start going down a road thinking that's where they'll achieve their sexual health or their sexual comfort by doing all these things that pop culture is telling us that needs to be done.
Is that ever a win? Is that ever a win?
When I was making earlier about the ghosting on the Tinder site, the Tinder may be a hookup site. I'm talking about people that jump on these Match.com or these Harmony that's really about relationships. And some people use that as a hookup site, and somebody embraces a person and then they ghost them, and then they're like, what's wrong with me? What did I do wrong? And that affects the sexual and mental health aspect of it. Mm-hmm. And then they try to go and get doctored up, whether it's superficial or through cosmetic surgery, or they're trying to do it through physical workouts, whatever. And I'm jumping back and forth now, but we're talking about sexual health and mental health, and that's where the connection is. We need to be comfortable with ourselves, comfortable within ourselves, and that easily achieved. I know that, but if we work towards it and we identify what we need to do, I think we can get there.
Well, let me ask you this. Go ahead, Pipes.
No, please.
You touched upon plastic surgery, and we have talked a lot over the years about the benefits of plastic surgery up to a point to feel better about ourselves. I mean, God knows I spent hundreds of thousands of dollars with this face and this body, and it's clearly paid off. But when is enough enough? When is it too much? When does someone, how big do your lips have to be, or butt lifts have to be, or boobs have to be? When are we pleasing ourselves? When are we pleasing our partners? When are we pleasing some sort of ego we can never catch up with? How do we restrain ourselves from plastic surgery?
It's funny, Bill, you look at the animal world, it's always the male that's more attractive, right? Whether it's a duck, a peacock, I guess when I'm about birds, it's the male that has to look really good to attract the female. But in our world, it's the female who's taken predominantly the role of trying to attract, whether it's through makeup and, us guys, we're slobs, we don't care. But, women, it's interesting phenomenon.
You are 100% right on. And I think especially now, social media and all of the things that are out there.
The Kardashians.
You can watch how many people teaching you how to put makeup on and to do whatever, and I think I'm not the norm in so many aspects of this, because I'm too lazy to do a bunch of makeup and comb my hair. But
hey, we got Trish coming out about herself. She's talking a lot about herself.
Can you have DoorDash plastic surgery where you're too lazy, they just come to the door and puff up your lips?
God,
and
I wish somebody would come and put eyelashes on me every day.
That should be a sponsor for us. You know,
Like, lay in
Jose,
bed,
see if we can get
lay in
DoorDash
bed.
plastic surgery to sponsor us.
All right, working on it.
I'm actually thinking that's money. So might be on something. But like I'm gonna put myself out there. I had breast augmentation done 18, 19 years ago, a long time ago.
And we all thank you. We appreciate it.
And you're welcome.
See what pigs we
And
are?
I'm
What
glad,
Bill
I'm glad we
finds
can all
this.
be a
Thank
part of
you.
this together. But the thing is when I did it because I was like an A- after kids. Like I think I was concave at that point, and so I did it for me. 100% did it for me. My husband was totally against it. Did not want me to go down the path. And I did it and I felt good. I wanted to look better in clothes. I wanted to not pad everything that I was wearing, blah, 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 blah. And again, mind you, this is a long time ago.
Yeah, I think it's very important. I think here's some great points about self-esteem.
Yeah, and it was for me. It was not because I needed to look more attractive to other people. My husband didn't need that from me. All of that. My kids now, and I have daughters. I have 2 daughters. So for me to be I'm very, very open about having this surgery. And if I could go back, I probably would not do it.
Why is that?
Down this path.
Why would you
20
not?
years later, why would you not? Yeah.
Because now it's a burden. Now I have to deal with boobs. It'd be so much easier. I got a dress for my daughter's wedding.
I got to deal with man boobs. I fully understand. I got to deal with that shit.
I mean, it's such a different, because it's not important. I look at my daughters who I'm so speaking out of turn here, but they were blessed with my original anatomy, and they're perfect. My daughters are perfect, and they feel so good about themselves. This for me, let's go into the mental health aspect. Let's go to my, my psychology in my head at the time is this is what I needed.
Let me ask you this.
It didn't change anything. It changed how people acknowledged me.
All right.
And I would say men reacted to me differently because of my breasts. 100%, without a doubt. And especially in a male-dominated field like I was in. Like, I can say that is... But nowadays, and we are also looking at a different generation and how people look at that. And now women that are, flat-chested, and the clothes that they wear and the things that are designed to be very, very flattering for that. I was a different generation than the generation that's here now.
Pipes, so you have 2 daughters, right?
Correct.
Yeah, because we just lost, once you start talking about your daughter's breasts, we've lost 2 subscribers just now. So I'm wondering, have they unfriended us or whatever the hell it's called?
They probably have.
Have.
I don't think my kids will friend me. They're appalled that I have these conversations in public anyway.
Well,
they don't use their real names on our like list, so
I think there's some cool topics. There are a couple things, if I may, and I'm going to say this is just as a hit and run. I see one thing that troubles me aggressively in sexual health, and it has to do with the other aspect of my life in infertility. And I see a lot of couples come in, they're very, very frustrated because they're trying to conceive and they can't. It's frustrating. It's a different profile of things that they thought they'd have to worry about. And it's very, very expensive to talk about male and female assisted techniques for conception. And I see these guys who have gone from having sex occasionally are now on a timetable, and around the time of ovulation are really by their cell phones, and they're waiting to get the call of when their partner is ovulating, and to go from a time when there's normal interaction and mating and all this stuff, now it becomes work. And so I find that be very frustrating and really taxing from an anxiety and a depression and a mental health point of view from both the male patient, who does oftentimes have difficulty in performing on demand, and a female from point of view where the frustration of her own time clock, and that's changing as we are expanding our horizons in fertility. But the last thing that I want to talk about, and it really caught my attention when I was on, Amazon Prime, Jose, looking for some electronics, and I came across the Lioness vibrator that's Bluetooth. Have you guys heard of this? Pipes, Matt?
My first question comes to mind is, how do you stumble on a vibrator?
Oh.
And my question is, why did you not forward that information to me?
Well.
Oh, I got it. Why did you send it to me and not Trish?
For obvious reasons.
And secondly, everything's Bluetooth now, so I'm not surprised. But go ahead.
The whole idea, I stumbled out because my porn site shut down for some reason. I don't know what the deal is. Joking. It didn't shut down. It didn't shut down.
Bluetooth right now?
Yeah.
You got a Bluetooth right
So a vibrator, which we use all the time, and I recommend all the time for men and women for a whole bunch of different reasons. And Shelby Holly sold them in our clinic as part of expanding everyone's sexual menu. And vibrators, men use it to improve orgasmic function. Women use it, men and women use it as an adjunct to healthy couples relationships. So it's no longer kinky or abnormal or off the farm. But I've always looked at...
the name of this is what?
The Lioness
Bluetooth. So I
understand
you said
vibrator.
Bluetooth. So if Trish had it in her hand or had it in her...
It would not be in my hand.
Okay, if it was in Trish's possession,
it's a bird in the bush.
I can link it to my phone. I can link it to my phone, and I can turn it off and on for her.
No, what it does, it's artificial intelligence. It's biofeedback.
Oh my God.
It tells the user. It's like a Fitbit.
Oh my goodness.
Yeah, there it is. Hotspot It's a fucking algorithm. The Lioness, the vibrator 2.0. Which means, God forbid, you've got the 1.0.
Look at that. You got 4 easy payments of $57.25.
But it's crazy. It is. Oh, thank you, Jose. It is a way of using biofeedback to determine you're not listening to your body. You're looking at an app on your phone. What the hell has happened to our society? We have to determine whether we're turned on based on what the app reads. A vibrator, I get it. It has value. It has use. It's great. But to hook it up to your cell phone, to look at the biometrics and determining whether you're coming or not, I am blown.
For $230, trust me, this is free.
Is that the Boy Scout sign? What is? I don't know what that is.
We will.
I like the peace sign.
What's the motto of the Boy Scouts?
We're going to Trish's house. We're going to Pipes' house, I guess, is their new motto. So, I mean, does anyone find this outrageous?
100%.
Yeah.
That's ridiculous. But I mean, that's the world nowadays.
Yeah, I mean, you got Apple
Everybody
Watches, you got these Fitbits, everything tells you what your heart rate is, all that stuff.
Well, this is the fuck bit, okay? This is the fuck bit. How many orgasms do you get in a 24-hour period?
I like that fuck bit.
Yeah.
Let's trademark that name. Yeah.
No, am...
That's crazy.
Jose, have you ever... I know you're opening up a box now. Did you order one already? What the hell?
Yeah, it's for research purposes.
Research purposes. No, seriously, and you bring up a good point. There years ago, with Dr. Irwin Goldstein, San Diego, the king of sexual health in men and women. Yeah, he talked about MRI studies where you would have couples in Europe having intercourse, and I guess it was a very wide MRI. where they would see different parts of the brain light up in the men and different parts of the brain light up in women, and versus the genitalia. In light up meaning there was more blood flow, implying stimulation or arousal in both in the genitalia and in the brain. And there was a disconnect with men and women. And interesting information from a research point of view, but it speaks to there's some disconnect in men and women, how they respond to sex. But to have this as a vibrator and to look on my app and says, how many orgasms did you get in? Means it's just crazy. It speaks to one where Big Pharma has left off. There's going to be another giant coming in and filling a problem and treating a problem that we have in society. And that's not feeling good about ourselves and not feeling comfortable with our sexual health. So I'm hoping that we take the place of Big Pharma, these kinds of deals that are going on.
My concern with the device is you'll start using it to measure against a real partner, right? If I was my device, I got this many orgasms at this type of intensity, and I'm with my partner, I'm not getting there. I mean, you're setting up unreal expectations, artificial and non-artificial. That's the problem I see happening here.
This is a conversation that we could expand on incredibly.
Well, let's do this for all of those users of the Lioness 2.0. Give us a call. Check in with us with sexualhealingpodcast.org. Look up Sexual Healing Podcast on TikTok and YouTube. Give us your response to today's broadcast. We look very forward to hearing from you this week and seeing you as viewers next week. I'm Dr. Bill Mac Pipes. Cody, Jose, and Holly Shelby somewhere out there in Mumbai. Thanks for listening. We'll see you next week.
Ciao. Thank you all.
Welcome back, my friends, to the show that never ends.
Thank you for joining the show that never ends. We will pause with our part. However, you can reach us at sexualhealingpodcast.org. We are here to make your sexual health be everything you want it to be. We'll visit with you next week for another episode of Sexual Healing Podcast. Stay sexy out there.